Hey everyone, welcome back, or if you're just joining us, welcome to KSSP Podcast. I'm Spencer.
And I'm Katie.
And in this part of our nutrition series, we're going to be going over a couple vitamins and minerals. So we're going to start with vitamins here. And vitamins are essential for the formation and synthesis of neurotransmitters and the metabolism of brain lipids, protect the brain from toxins, boost immunity, and regulate many chemicals that make us more or less anxious. So we're going to go to vitamin B first. And it has been shown before that a vitamin B complex may help reduce anxiety, possibly by reducing oxidative stress in the brain. We're going to talk about a couple of the different vitamin Bs. So we'll start with folate, which is B9, and vitamin B12. So deficiency in B12 results in a folate deficiency, which can ultimately contribute to loss of brain cells, chiefly those located in the hippocampus, which they call hippocampal atrophy. And that has been associated with depression. The hippocampus is a critical brain structure that plays an important role in learning and memory. Some studies have also demonstrated that the higher one's folate level, the lower one's level of depression. Folate may also affect serotonin synthesis. And then vitamin B9, which is folate, deficiency of folate has been associated with chronic fatigue syndrome. It is involved in cell development throughout the body, and macrocytic anemia is commonly caused by folate deficiency.
All right. Next, we'll talk about thiamine, which is B1, and pyridoxine, which is B6. So these help the brain produce and synthesize neurotransmitters involved in mood regulation. Vitamin B1, decreased levels of vitamin B1 can result in altered mitochondrial activity. Neurons have high energy requirements, which means they are especially vulnerable to a thiamine deficit. Up to 250 milligrams of thiamine has been shown to be effective for anxiety. And then with vitamin B6, it is low in patients with chronic fatigue syndrome and disruption of the connections among brain cells. There is a disruption of the connections among brain cells, and this decreases efficient processing of information.
And then we're going to talk about vitamin A briefly. Vitamin A facilitates proper brain function, such as the growth and adaptation of neurons. Deficiency of vitamin A may result in shrinkage of certain brain areas, disturbing how the brain responds to stress. There was a study that found vitamin A can significantly improve fatigue and depression in multiple sclerosis patients. But too much retinoic acid, which is a metabolite of vitamin A, has been associated with depression and suicide. But that is typically far beyond what you're going to eat in a healthy, varied diet. But it's still good to just be aware of that so that you're not taking a bunch of vitamin A.
So then with the vitamin C, it's responsible for the regulation of neurotransmitter synthesis. It's a crucial antioxidant, and fatigue is common if vitamin C levels are low.
And then vitamin D. Studies have demonstrated that adults with depression and anxiety have lower blood levels of vitamin D. Vitamin D is increasingly recognized as a necessary substance called a neurosteroid, which crosses the blood-brain barrier and enters brain cells. It can decrease inflammation it can decrease inflammation and toxic destruction of cells and controls the release of nerve growth factor, which is essential for survival of hippocampal and cortical neurons. The hippocampus plays a crucial role in providing feedback to the HPA axis when there is stress, and it is also intricately connected to the amygdala. About 80% of our vitamin D comes from exposing our skin to direct sunlight, so sunlight streaming through our windows does not have the same effect since glass absorbs all ultraviolet B radiation. And vitamin D deficiency is occurring in epidemic proportions worldwide. Not having high enough levels can lead to inflammation and brain injury. And it also helps nerve growth and assists in the production of brain tissue. Vitamin D does. But something also just to keep in mind with thinking about getting vitamin D is skin cancer risk. It's important to know your risk factors and be safe. And there is little evidence that sunscreen decreases vitamin D concentration when used in real life settings, suggesting that concerns about vitamin D should not negate skin cancer prevention advice.
So next, we're going to talk about some minerals. And the first one we'll go over is iron. It helps make up the covering that protects neurons and helps control the synthesis of chemicals and chemical pathways involved in mood. A large concentration found in the basal ganglia, the collection of brain cells that have been implicated in depression. In clinical studies, low iron levels and depression have been linked.
And then we'll talk about magnesium. There have been countless studies suggesting that depression is related to magnesium deficiency. Magnesium deficiency is also associated with high anxiety levels. Magnesium supplementation can help, especially if you are vulnerable to anxiety, likely because of the way that magnesium can ease stress responses by changing levels of harmful stress chemicals in the brain. Dietary intake of magnesium is poor in Western populations. 68% of Americans consume inadequate amounts of magnesium. Patients with chronic fatigue syndrome have low magnesium levels, and magnesium decreases inflammation and relaxes the nervous system. But just so you all know, supplements, while they can be effective, it's always important to talk to a healthcare provider and or nutritionist before picking on any supplements, just depending on whatever other health conditions you may have that could be affected by supplements.
Yeah, or if any medications you have can interact with them. So next we'll talk a little bit about potassium. The information's not super clear on potassium, but some studies have shown that higher potassium intake can improve your mood.
And then zinc. So most evidence strongly supports a positive association between zinc deficiency and the risk of depression. Blood zinc concentrations have been shown to be lower in depressed subjects compared to control subjects. Low zinc levels are also a hallmark of chronic fatigue syndrome. And so increasing zinc can improve and prevent fatigue.
So just as a general statement here, like supplements, which can include like over-the-counter vitamins, they're pretty like in their pill form and everything. Like if you're just buying them as a supplement and not eating them in your food. These supplements are pretty loosely regulated, so it's important to do your research on the manufacturer before starting any supplements. We're going to go over the issues with the supplement industry in the next episode, but I just wanted to put that statement out there.
Yes. And then just with vitamins and minerals, we're just going to go over a couple of different sources, I guess, and then also just recommended intake. So these are all going to be from the National Institutes of Health, Office of Dietary Supplements, and we'll just start with vitamin B12, and this is the fact sheet for health professionals. And as always, for all of these, there's also going to be a consumer fact sheet on vitamin B12 if you want to look at that one too, but we're going to be looking at the one for healthcare professionals. So we're just going to look at recommended dietary allowance for vitamin B12 here. They have a little table. So for birth to 6 months, it's going to be 0.4 micrograms regardless of gender. 7 to 12 months is going to be 0.5 mcg regardless of gender. 1 to 3 is 0.9. 4 to 8, it's 1.2. 9 to 13, 1.8. 14 to 18, it's 2.4. But if there's pregnancy, then it jumps up to 2.6, and lactation jumps up to 2.8. And then 19 and older, again, it's 2.4 for regardless of gender, and then pregnancy is going to be 2.6 again, and lactation is 2.8. And then we'll just look here at table 2 that show some different foods, and then their micrograms per serving. So as we can see, salmon will have 2.6 micrograms of vitamin B12 per serving. Milk, 2% milk fat, 1 cup of that has 1.3. 1.5 ounces of cheddar cheese has 0.5. And then 1 medium banana has 0. So the bottom ones have 0. So those are some vitamin B12. So then we'll move on to folate, which was vitamin B9, I believe, if I remember correctly.
Yeah.
So again, we'll look here at the recommended dietary allowance. So birth to 6 months, that's going to be 65 mcg regardless of gender. 7 to 12 months, it's going to be 80. 1 to 3 years, it's 150. 4 to 8, it's 200. 9 to 13, it's 300. And then 14 to 18 and 19 and older is both 400. And then for pregnancy, 14 and greater is 600. And then lactation, it's 500. And then we'll look at this little table here, table 2, that has food. And again, so 4 spears of boiled asparagus is going to have 89 micrograms. Micrograms. Cooked spaghetti, half a cup is 74. Half a cup of a raw sliced avocado, 59. And then we'll look at orange juice. 3/4 cup of orange juice is going to have 35 micrograms. And then we'll move on to thiamine. So recommended dietary allowances for thiamine. Birth to 6 months is going to be 0.2 milligrams. 7 to 12 months is 0.3 milligrams. 1 to 3 years, 0.5. 4 to 8, 0.6. 9 to 13, 0.9. 14 to 18, so 1.2 milligrams for males, 1 milligram for females. And pregnancy is going to be 1.4 milligrams, and lactation is 1.4 milligrams. 19 to 50, it's 1.2 milligrams for males and 1.1 milligrams for females. And then for people 51 and older, 1.2 for males again and 1.1 for females. And then we have foods again. We'll look at that table. So 1 plain enriched English muffin has 0.3 milligrams. Bread whole wheat, 1 slice has 0.1. And then low-fat plain yogurt, 1 cup has 0.1. And then we'll move on to vitamin A. So recommended dietary allowance, birth to 6 months is 400 micrograms, regardless of gender. 7 to 12 months is 500. 1 to 3 years is 300. 4 to 8 years is 400. 9 to 13 is 600. 14 to 18 years is 900 micrograms for males. 700 micrograms for females, and that's going to continue throughout the rest of your life. And then for pregnancy, so if a 14 to 18-year-old is pregnant, it's going to be 750 microgram recommendation, but 19 to 50, it jumps to 770. And then for lactation, 14 to 18 is 1200, 19 to 50 is 1300. And then we'll just look at some foods here again. So 1 whole sweet potato baked in skin is going to have 1403. Raw carrots, half a cup is 459. And then half a cup of red raw sweet peppers is going to have 117. Then we'll move on to vitamin C. So recommended intakes there, if 0 to 6 months is 40 milligrams, regardless of gender. 7 to 12 months is 50 milligrams. 1 to 3 years is 15 milligrams. 4 to 8 years is 25 milligrams. 9 to 13 years is 45. 14 to 18 years is 75 milligrams for males, 65 milligrams for females, 80 milligrams for pregnancy, and 150 milligrams for lactation. And then 19 years and older is going to be 90 milligrams for males, 75 milligrams for females, 85 milligrams for pregnancy, and 120 milligrams for lactation. And individuals who smoke require 35 milligrams per day more vitamin C than non-smokers. And then we will also just briefly look here again at foods. So orange juice, 3/4 of a cup of orange juice will give you 93 milligrams. One medium kiwi fruit will give you 64 milligrams. And then half a cup of raw broccoli will give you 39 milligrams. We'll look at vitamin D. Here we go. Recommended dietary allowance for vitamin D. So for 0 to 12 months, it's going to be 10 micrograms or 400 IU. For 1 to 13 years, it's going to be 15 micrograms or 600 IU. 14 to 18, it's going to be 15 micrograms. For even pregnancy and lactation is also 15 micrograms or 600 IU. And then 19 to 50 is also 15 for everything or 600 IU. 51 to 70 years is also 15. And then greater than 70 years, it's going to be 20 micrograms or 800 IU. So then it goes up a little bit once you get 70 or older. And then vitamin D content of selected foods in table 3. We'll look here. So milk, 2% milk fat, vitamin D fortified, 1 cup will give you 2.9 micrograms, which is 120 international units, IU. 1 large scrambled egg will give you 1.1 micrograms or 44 IU. And 1.5 ounces of cheddar cheese will give you 0.4 micrograms or 17 IU. And then we'll look at iron. So recommended dietary allowance for iron, birth to 6 months is 0.27 milligrams, regardless of gender. 7 to 12 months is 11 milligrams. 1 to 3 years is 7 milligrams. 4 to 8 years is 10 milligrams. 9 to 13 years is 8 milligrams. 14 to 18 years is going to be 11 milligrams for males, 15 milligrams for females, 27 milligrams for pregnancy, and 10 milligrams for lactation. 19 to 50 years is going to be 8 milligrams for males, 18 milligrams for females, 27 milligrams for pregnancy, and 9 milligrams for lactation. And then 51 years and older, it's going to be 8 milligrams regardless of gender. And then food sources. So let's say you want half a cup of firm tofu, that'll give you 3 milligrams of iron. Or if you want 1 cup of canned white beans, that'll give you 8 milligrams. Or if you want 1 slice of whole wheat bread, that'll give you 1 milligram. Then we'll move on to magnesium. So recommended dietary allowance for magnesium. Birth to 6 months is going to be 30 milligrams, regardless of gender. 7 to 12 months is 75 milligrams. 1 to 3 years is 80 milligrams. 4 to 8 years is 130 milligrams. 9 to 13 years is 240 milligrams. 14 to 18 years is going to be 410 milligrams for males, 360 milligrams for females, 400 milligrams for pregnancy, and 360 milligrams for lactation. 19 to 30 years is going to be 400 milligrams for males, 310 milligrams for females, 350 milligrams for pregnancy, and 310 milligrams for lactation. 31 to 50, it's 420 milligrams for male, 320 for female, 360 for pregnancy, 320 for lactation, and then 51 years and older, it's going to be 420 for male, 320 for female. And then food sources. So for magnesium, let's say you want 1 ounce of roasted pumpkin seeds, that'll give you 156 milligrams. Or if you want 1 ounce of dry roasted almonds, that'll give you 80 milligrams. Or, maybe some cashews. If you have 1 ounce of dry roasted cashews, you're going to get 74 milligrams of magnesium. And then we'll move on to potassium. So adequate intakes for potassium. Birth to 6 months is going to be 400 milligrams, regardless of gender. 7 to 12 months is 860 milligrams. 1 to 3 years is 2,000 milligrams. 4 to 8 years is 2,300 milligrams. 9 to 13 years is going to be 2,500 milligrams for males, 2,300 milligrams for females. 14 to 18 is going to be 3,000 milligrams for males, 2,300 for female, 2,600 for pregnancy, 2,500 for lactation. 19 to 50 years is 3,400 for male, 2,600 for female, 2,900 for pregnancy, and 2,800 for lactation. And then 51 years and up is 3,400 for male and 2,600 for female. And then some food sources here of potassium. Let's say you want 1 cooked cup of lentils. That's going to give you 731 milligrams. If you want half a cup of raisins, you'll get 618 milligrams. Or if you want 1 medium banana, that'll give you 422 milligrams. And then lastly, for this one, we got zinc. So recommended dietary allowances for zinc is for birth to 6 months, it's going to be 2 milligrams regardless of gender. 7 to 12 months, it's 3 milligrams. 1 to 3 years is 3 milligrams. 4 to 8 years is 5 milligrams. 9 to 13, 8 milligrams. 14 to 18 is going to be 11 for males, 9 for females, 12 for pregnancy, 13 for lactation. And then 19 years and older is 11 for male, 8 for female, 11 for pregnancy, and 12 for lactation. And then some food sources for zinc. If you want 1 ounce of roasted pumpkin seeds, you're going to get 2.2 milligrams. If you want 1.5 ounces of cheddar cheese, you're going to get 1.5 milligrams. And let's say you want 1 cup of 1% milk. That is going to give you 1 milligram. So those are just a couple of different how much is recommended for the average person and what food sources have each amount, so that you can kind of try to get, because getting vitamins, any of these things that we've talked about today and are going to still talk about, is the best way to get anything is from the food. So if you are able to get it from your food by looking at some of these charts and tables and maybe putting together like a meal plan, that would be the best way to get your nutrients over supplements. And we will actually be talking about supplements next. So, as always, you can leave a comment below if you have any topic ideas you want us to go over in future episodes.
You can find us on Facebook, YouTube, Instagram, Twitter, and TikTok. And we also occasionally live stream on Twitch, so you can follow us there if you want to see when we do.
And don't forget to give this video a like, as well as follow or subscribe to our other social media accounts, and turn on notifications so that you get notified when our new content comes out. Otherwise, we will see you all in the next video.